Okay.
So in this video, we're going to do a demonstration on putting a Foley catheter in, okay? So the first thing we do have to have is a doctor's order. And we have a doctor's order here to place a Foley catheter, insert a Foley catheter. Okay, so I'm gonna come in the room. Hello.
Hello.
My name's Debbie. I'm gonna be your nurse today, and I have an order to put a Foley catheter in. Have you ever had a catheter before?
No.
Okay, it's just a tube that's gonna go into your bladder, and it's gonna drain your urine for you, so you won't have to get up and go to the bathroom. Okay, do you have any questions about that?
No.
Okay, can you tell me your name and date of birth, please?
April showers.
Okay, and your date of birth?
May 28th, 62.
Okay, great, perfect. All right. So the first thing I'm going to do, I'm going to need to expose you so I can look to see where I'm going with the Foley catheter. So, are you cold right now?
No, I'm good.
Okay. It might get a little chilly because I'm going to have to expose the bottom part of you. Okay. And we're just going to go ahead and take your covers all the way down. I'm going to get you to put your heels together and let your legs fall all the way apart. Okay, and I have a flashlight here, and I'm just gonna look for where I'm gonna go. I'm looking for the meatus here. Okay, I see a good visual of that. So I'm gonna just kind of keep you covered up there just for a little bit while I set everything up. Now this is a sterile procedure, so we have to remember the principles of aseptic technique. That include things like dropping your trash 6 inches above, not dropping below your waist, not touching outside. When you're sterile, you don't touch outside a 1-inch border. And when you're not sterile, you can only touch the 1-inch border, okay? So I'll go over that again here in a minute when I set it up to show you. So make a little trash receptacle just by taking your bag that the Foley came in and use 2 pieces of tape and tape up your bag to the table, okay? Now, this is my kit. So I'm gonna take the little flap, and this is gonna open away from you because one of the principles of aseptic technique is opening away from you. And really make sure your bed is at a working height for any kind of sterile procedure for sure. Okay? So I'm gonna kind of start low here because I'm gonna make a drape right above that. All right, so opening away from you like this. And you're gonna open the sides, and this is where the 1-inch border comes in. So you see how I'm touching just the 1-inch border? And the other thing, you can't go straight over your sterile field. So if you have to reach the other side, you're gonna have to kind of go around. So in other words, if I wanted to get this side, I'm gonna have to go like this. And I'm gonna have to kind of work with this a little because these brand new packages get really difficult to open. And you can kind of underneath, get it kind of straight like that. Okay, now I have my sterile gloves inside there, and I really encourage you to use the gloves that are in here unless you absolutely have to have a bigger size. These are pretty standard sizes. You cannot turn your back on your sterile field, so you have to at least be to the side, okay? So I'm gonna go ahead and put my sterile gloves on, and right before I do that, I'm gonna go ahead and expose the patient so I don't have to worry about that part. Okay? Sterile gloves. Okay, now I've got my drape right here. This is the drape I'm going to use. It's the blue drape. The shiny side always goes down, okay? This is called a fenestrated drape, would be for males that you may want to use. It has a little opening in it, And so this is a female, so we're just gonna lay that down there. Notice I'm not dropping it close. I'm dropping this up here. I don't wanna get close to any non-sterile field. Now, this drape is sterile, okay? If this drape were not sterile, I could only touch the outside borders, but this is sterile, so I'm sterile to sterile. That means I can touch any part of this, and it's okay. Okay, so I'm gonna take the drape. You can't let it touch the legs, and I'm just gonna let it fall like that, okay? Now I can touch this, and now I cannot touch the 1-inch border because it's been dropped. Now it's considered not sterile on the outside, okay? I'm gonna pick this up and put it just like this. And then I'm gonna start taking things out of the container. And again, watch your 1-inch border. And it's gonna fold down sometimes, like y'all know, you can't help it. You don't want it to drape down like that if you can't help it. Okay. Your syringe, you're gonna take this and carefully unwrap the plastic on here because your catheter will get away from you if you're not careful. Doesn't matter where you drop that. You're just gonna pick this up, carefully put it in there, and you're gonna connect your syringe to this port here that has the grain on it. You're gonna screw it in tight and just lay it down. Then you have your KY jelly or your lubricant, okay? And you're just gonna take this, and I really want you to do this in practice. Notice I'm holding my arms up and I'm not falling down into my sterile field. So I'm holding my arms up to maintain sterility. Okay, now I can just drop this like that. Open up my, this is to simulate povidone iodine, which is betadine. You would always want to ask the patient if they're allergic to betadine if you're using a betadine type of solution. Sometimes they use Hibiclens, which is another cleaning solution. But if it's betadine, you would want to ask, are you allergic to betadine or are you allergic to shellfish? Because shellfish can be a crossover allergy to betadine. Okay? All right, so I got this ready to go. I'm just gonna lay it right there, keeping it in the sterile field, okay? And now I am ready to clean, but before I do that, I'm gonna take this, because I'm gonna wanna get a sterile specimen. My order said to get a sterile specimen when I put the catheter in, okay? So I'm just gonna take this, very carefully put it right there, keeping my gloves sterile, and I'm keeping my hands in between my shoulders and my waist. I'm not dropping below, I'm not going above. Okay. All right, so I'm gonna go ahead and get one swab. And you always wanna start away from you first. You're gonna have to commit this hand. You commit this hand, this means this hand is no longer sterile. You cannot use this hand again, okay? You already know where you're supposed to go because you looked ahead of time. You're gonna go in and you're gonna clean down from the upper to lower of the outside and all the way down. Take it. And we're going to the labia minora is what we're cleaning. So away from us first. If this happens to you during the procedure, leave it alone. Okay? This is dirty there, but it's not touching any part of your sterile field. Now you're gonna go to the labia minora closest to you, straight down. You really wanna clean good. Never go back up. Okay. And we got one more, so we do 3. Straight down the middle. It's real important you get this part really good and clean. Straight down, one time, drop. Okay. Now, are you ready for me to insert the catheter?
Okay.
Great, okay. Pick it up so you have plenty of slack there. And here we go. 1, 2, 3. Walk your fingers back as you're putting it in. And you're gonna go up until you see urine return. And you're not gonna get real urine return or any kind of return from these mannequins. So you're gonna verbalize, I got urine return. Then when you get urine return on a female, you're gonna go 1 to 2 inches past that, okay? I'm gonna go up a little more, and then I'm gonna take these 2 fingers and I'm gonna hold it like this, okay? You're not considered sterile anymore. Now you can take a deep breath, you're not sterile, okay? You don't have to worry about being sterile, you're just being clean. See, now you're gonna blow up the balloon, but notice I'm holding it with this, because if I didn't hold it, this whole thing's gonna fall right out. Okay, so I'm gonna go ahead now and blow up the balloon. And you have to hold pressure on the plunger. Now you can let go because you got the balloon already inflated. I'm holding pressure on this plunger because if I don't, this is what happens. See how it comes right back? So I'm holding pressure on the plunger while I disconnect here. Okay. Now you can give the patient privacy. Cover the patient up. You doing okay? Always talk to your patient. And by the way, your catheter will be pulled back until you feel resistance once you inflate that balloon. Okay. Now this has to be hung not on the bed rails. It can only be hung on the frame of the bed. So we have, we'll just say this is the frame. We would put this on the frame of the bed. We cannot put this on the actual side rail. Or this, actually this bed might have, let me raise this up. Some of them have actual.
There's a hook over here on this side.
For it. Okay, this one has a hook right here.
Mm-hmm.
Yeah. Okay, that'll work right there. Okay, so now that's hanging. That's kind of in the way, but sorry. All this now can be cleaned up. And we're gonna go ahead and tape it. Sorry. Give it plenty of slack. Okay, and you just tape it like right here. And they do have some commercial holders that work a lot better to hold the catheter in place in a lot of places. This can all go in the trash. And I can go ahead and cover my patient back up. Okay, that's the insertion. Now, if I have the order to get a specimen, this is the first time I've put the catheter in, I can go ahead and get the specimen directly from the bag. Okay, this is the only time I can do this. So let me just show you how you do this. Just like we talked about in class, we're gonna take the lid and without touching the rim, and we're gonna come down here and we're gonna not touch the tip of this, and we're just gonna open this. And we're gonna just let the urine get in there about half full. Okay, and you'll close it. Put it back in there like that. As quickly as you can, put your lid back on, do all your labeling, as we said before, put it in a biohazard bag and get it to the lab as soon as possible, okay? If this is 2 hours later or any time after that, you would get a needle and a syringe, and you would, if there's urine in the tubing here, then you're good to go. You can go ahead and get it. If there's no urine in the tubing, you may have to clamp it. You might have to clamp it, say, a little bit down here, and you can use this to clamp it. So you just clamp it with this, come back in about 15 minutes, make sure you come back, and then you should see some urine in the tube so you can get your specimen. Okay. So to get the specimen, you would just take your syringe. You would wipe this port with alcohol right here. You don't have to have a needle. It's got a port that doesn't require that. Okay, this is only a 10 ml syringe, so you would, obviously you may need a bigger syringe. You'd have your urine, and you just follow the same procedure that you followed for collecting, in that you don't touch the lid, and you would just put your urine into the cup. Carefully replace the lid and get it to the lab the same way. Okay, you doing okay?
Yes.
All right, let me get you covered back up. And you have your call light. If you need me, just give me a call. You may have a sensation that you have to urinate, but it's okay. It is going into the bag. And that usually does go away after a little while. Take your gloves off the right way. Okay, I'll be back to check on you soon.